Namaskar दोस्तों, welcome to channel Toxicology and More. Today in this video we'll be discussing another important DABT topic, that is ethanol toxicity, and some of the important concepts with respect to ethanol toxicity. I will not discuss ABT recertification questions because on ethanol and ABT recertification questions already I have uploaded some videos in the my channel. I'll give the link in the description. You can go back and check those questions. Today some other important topics which are not covered with respect to ethanol toxicity, those questions we will discuss. So first thing is that this particular diagram is taken from lesson textbook. So one question with respect to ethanol you will get in exam. They will give you some example. For example, they will give you ethanol and they will give you some other chemical. For example, carbon tetrachloride. So ethanol, when it is used in combination with carbon tetrachloride, what type of adverse effects you will, what type of toxicity you will be seeing, whether it is potentiation, whether it is cumulative, whether it is synergistic, like this they will give you example. So previously in the recertification, ABT recertification questions papers, they have asked ethanol with respect to CCl4 in combination. So in our exam, they might replace it with some other example. Why? Because you have to always remember whenever they're asking this type of questions, no, they come under principles of toxicology. So here they will give you examples, drug X and drug B, or a chemical X and chemical Y. So with that they will ask you to choose what type of option, whether it is antagonism, potentiation, synergism, agonist, like that. Okay, you have to remember the examples. So we'll see important definitions. Define cumulative toxicity. So these things I have taken it from Clayson 9th edition, page number 31, and the references I have taken some of from the Indian author, that is P.K. Gupta textbook. Define cumulative toxicity. It is a progressive toxicity or harmful effect produced by summation of incremental injury resulting from successive exposure. Liver fibrosis produced by ethanol. So some questions with respect to ethanol and its association with fatty liver and its association with liver cirrhosis, they will ask you in the exam. So alcohol upon chronic consumption will cause liver fibrosis. So fibrosis is a type of damage which do not occur upon immediate exposure or single exposure, upon acute exposure. This will take over a period of time. That is the reason it is cumulative toxicity. Okay. Then next we will see what is synergistic and potentiation effect. Here in the diagram you can see synergism as well as potentiation. Synergistic or potentiation effect is observed when the combined responses of two chemicals, as I told you, they'll give you a chemical X and chemical Y, or drug A plus drug B, are much greater than the sum of the response to each chemical when given alone. Okay, here you can see response A plus B. This is A, this is B. When you combine A plus B, the overall is 4 plus 4 is more than 10. It should be, generally it should be 8, but it is 10. For example, carbon tetrachloride and ethanol. So this is there in the Clayson textbook only, this example. So CCl4, when it is used with ethanol, you have synergistic liver toxicity, hepatotoxic compounds, but together they produce much more liver injury than expected based on the extent of damage at a given dose when administered alone. That is, if the effect of two chemicals exceeds the sum of their individual effects, 4 plus 4 is equal to 8. Synergistic or potentiation requires that the chemicals act at different receptors or effector systems. For example, chemical drug A is there, it will go and bind to some receptor, receptor X. Drug B is there, it will go and bind to receptor Y. But overall, the effect of this binding to X receptor and Y receptor, the overall effect is uh, more than the individual effect. Okay, if they're binding, for example, drug A is drug B is there, both are binding to the receptor X only, no, then it becomes challenge. If we have limited number of X receptors are there, only 10 receptors are, and we have molecules 10 A molecules are 10 B molecules are there, then there will be a competition will be there. So these drug and drug B cannot bind to. There will be saturation of the receptors will be there. If there is a upregulation of receptor, then it is okay. Okay, so these type of concepts you have to remember. They will give you examples in the exam. Next, the use of ethanol in methanol intoxication is an example of dispositional antidote. As it is, this is the concept. Why? Because this concept, what we were reading here, no, whenever in an emergency department, a patient comes who is having methanol poisoning. He has overconsumption of methanol. He has taken that patient. Then what this physician do in the emergency department? He will try to treat the patient with methanol poisoning by administering ethanol, alcohol. Okay, why? Because both ethanol and methanol, the metabolism is through same enzyme, that is alcohol dehydrogenase. So both will have a competition with this particular enzyme. So this alcohol dehydrogenase, it will metabolize ethanol. It will not metabolize methanol. As a result, methanol will have a toxic metabolite called formic acid, which will cause your blindness. So about this mechanism of ethanol and methanol metabolism, I have uploaded a video in my channel. I'll give you the link in the description. You can go back and check. Always remember with respect to alcohols, no, whether it's ethanol, methanol, ethylene glycol or isopropyl alcohol, their metabolism, what are the enzymes which are involved, what is the toxic metabolite which is formed, and this toxic metabolite, it is affecting which organ. For example, in the case of methanol, poisoning, formic acid is the metabolite, toxic metabolite, and it is causing blindness. Like that, you have to remember. So, this is the concept. Next, we'll see what are the hazards and the risk of ethanol. So, we have listed out here this ethanol, no, it is a effective fat solvent. So when take fat and dissolve it, put it in alcohol, this alcohol will dissolve this fat. Effective fat solvent after ingestion attack the liver and the brain and the nervous system. So what are the target organs of ethanol? Also, we'll read in this video, causing loss of control and anesthesia. Okay, it is affecting your motor incoordination. Excess of alcohol might cause anesthesia. It is going to affect your heart, it is going to affect your liver, it is going to cause cancer, that is tumors, dissolves natural oils from the skin. This ethanol vapors are poisonous and affect the nervous system. So that is the reason in a factory, if a workers are working with alcohol as a dissolving solvent, organic solvent, repetitive exposure may cause adverse effects on the CNS. Okay, so and it is flammable. Okay, because of the temperature, you can say that boiling temperature will be there, no heat. Next, we'll see what is cirrhosis. So one thing concept that you have to read with respect to alcohol is, upon chronic consumption of alcohol, it causes fatty liver, cirrhosis, cumulative toxicity. So first we'll see what is the definition of cirrhosis. Cirrhosis is a progressive disease that is characterized by deposition of the collagen throughout the liver. Here you can see these are the droplets, deposition of the collagen on throughout this particular liver. In most cases, cirrhosis results from chronic chemical injury. Example for this is alcohol. The accumulation of fibrous material causes severe restriction in the blood flow. So, in the blood vessels, because of this because of this fibrous tissue, no, flow of the blood in the blood vessels will be decreased. Restriction in the blood flow and in the liver, normal metabolic and detoxification process, because liver is the organ which is responsible for major metabolism of chemicals, xenobiotics. Okay, you have phase 1 metabolism, you have phase 2, phase 3, all these reactions are taking place in the liver. If the blood flow to the liver is decreased, the metabolism also decreases. And important thing is, the after the phase 1 and phase 2 metabolism, detoxification products will be formed. Okay, that detoxification process will be inhibited. As a result, toxins in the body will be increased. Okay, this situation can in turn cause further damage, eventually lead to liver failure. Okay, in humans, chronic use of alcohol is the single most important cause of cirrhosis. So, cirrhosis is the thing. The major example for this, alcohol. Alcohol is causing your liver cirrhosis. Sir. Okay, stop the video here. I will request you to go back and read in Clason textbook, tape 13.3. They have listed out various regions of the liver. If you look into a histopathology of the liver, no, you have portal triad will be there, different cells will be there, steroid cells, ito cells will be there, so zone 1, zone 2, based on the histopathology section. If you see, um, different regions of the liver will have cells will be there. So alcohol is particularly it is going to affect zone 3. Okay, hepatocyte this particular zone 3 as well as it is going to affect stellate cells. So one question with respect to region, which part of the liver it is going to affect alcohol that you will get in the exam. So we'll see one question. All of the following hepatic sites are matched with the appropriate preferential toxicant acceptor. So so ethanol, bile duct cells, no. Bile duct cells के लिए you have another example here. You can pause the video and see the example here. But alcohol, it is going to affect zone 3 as well as stellate cells. So we'll see what are the other options we get. Zone 1, hepatocyte iron is going to affect here you can see zone 1 we have here example iron is there and we have stellate cells. So in case of stellate cells vitamin A as well as your ethanol they're going to cause damage in the stellate cells in the liver. And if you look into zone 3 hepatocytes no it is carbon tetrachloride CCl4 is going to affect your zone 3. Okay, so one more question is give four examples of liver toxicants hepatotoxicants. Answer is carbon tetrachloride, ethanol, bromobenzene, acetaminophen. So pause the video here, read about acetaminophen. Here, that is nothing common name is paracetamol. So how it is excess of paracetamol that is around 4 grams. But in certain literature it is given more than 4 grams in a day. In certain places it is given 5 grams, more than 5 grams. In certain places it is given more than 6 grams. So whenever a person who takes more than 5 grams or 6 grams in a day of acetaminophen, it causes liver failure. Okay, that is what is a toxic metabolite? That is N-naphthyl benzoquinone. Naphthoquinone. So pause the video here, read about that concept. You might get some question with respect to that in your exam. So next we'll see some of the important tables which are taken from Clason CD summary as well as PK Gupta only. So here common toxins which are responsible for liver injury. So pause the video and try to liver different regions of the liver are there where they have also listed out the toxins. This particular toxin is going, for example, ethanol. It is going to cause fatty liver. It is going to cause liver death. It is going to impair this immune mediated response as well as it is going to cause fibrosis as well as cirrhosis. So similarly, pause the video here and read about other examples. For example, vinyl chloride, which is there in the case of rubber, vulcanization of the rubber. It is going to cause tumors. Arsenic, it is going to cause tumor. Metal, okay. Aflatoxin, which is a fungal toxin. It is also causing tumor. We have allothin, which might be used in anesthesia, which is causing immune-mediated response. As we discussed about acetaminophen, it causes liver cell death. And we have another metal called copper. It is also causing liver cell death. We have tamoxifen, which is a anti-estrogen used for breast cancer. It is causing fatty liver. We have valproic acid, anti-epileptic drug. It is causing fatty liver. So similarly, we have cyclosporine A. Other examples are the manganese, which is a metal which is causing canalicular cholestasis. Okay, so try to remember the examples and the region which they are going to cause liver damage. Okay, so all the information I put it in the form of a table. It will be easy for you to keep on memorizing these examples. Okay, next we have another question. What are the now we'll see in next 2 to 3 slides. We'll see how the liver is going to affect your nervous system, how it is going to affect your heart, how it is going to cause cancer. So till previous slide we have discussed how it is going to affect the liver. Now we'll see how it is going to affect your nervous system. There is a misconception that drinking alcohol, whether it is having beneficial effect or it is having adverse effect. Certain people know after consuming a certain amount of alcohol, they become highly active. But there are certain people who, upon consumption of alcohol, they undergo unconsciousness or they become more lethargic. They undergo a type of sleep or deep sleep they will undergo. So why? Because there is a difference in the rate of metabolism of alcohol in the men as well as the women, in the Asians as well as in the Hispanic. So different regions, ethnic regions, they have different types of that there is a variation in this alcohol in metabolizing enzyme, alcohol dehydrogenase enzyme, because of which they vary in the way they respond to the consumption of the alcohol. But this is how if you look into a typical dose response curve, no, as the dose increases, For example, you have taken one glass of alcohol, then you have no effect. I'm talking about in general population. Then you suddenly increase the amount of alcohol, like 2 cups, three glasses or 4 glasses. You undergo giddiness, sleep, deep sleep, unconsciousness, labor breathing, and finally death. This is the typical dose response curve for alcohol, but there will be exceptions. As I told you, males and females, there is a difference. Hispanic and Asians and Americans, Japan will be different. Okay, so we'll see what is neurotoxins, how alcohol is a neurotoxin that we will see. Neurotoxins are an extensive class of exogenous chemicals, neurological insults that can adversely affect the function in both developing and mature nervous system. Another thing that with respect to alcohol you have to remember is that alcohol can cross the blood-brain barrier and it can also cross the placental barrier. For example, a woman is there who is pregnant, and if she consumes alcohol, no, to that placental barrier, alcohol can cross. Why? Because of this lipophilic nature of this alcohol, fatty nature of this alcohol. Fat can be dissolved into the alcohol. First slide we have seen, no. So there is something called fetal alcohol syndrome that also I have discussed in one of my video. I'll give the link in the description. Read about one question with respect to fetal alcohol syndrome also you might get in exam. So both developing as well as mature nervous system this is going to affect. Okay, so that is the reason when you consume alcohol, certain individuals know they don't remember the memory they forget about the memory for that couple of hours when they consume the alcohol. These toxins may cause narcosis, behavioral changes. Some people are completely, they are highly active and decreased muscle coordination. They won't be able to walk. That's why, that is the reason you have many tests where they will be walking straight or such kind of test will be done for the people who have consumed alcohol because they show decreased muscle coordination. They are unable to walk. The term can also be used neurotoxins to classify endogenous compounds. Certain times our body itself will produce certain neurotoxins which when abnormally contact can prove neurological toxic. What are those examples? We'll see in some other video. So common examples of neurotoxins include we have a metal called lead that is going to affect particularly in the case of children neurotoxic. But our video is restricted to ethanol. So ethanol upon drinking alcohol it will cause neurotoxins. Pause the video here and read about other examples. For example, manganese metal, how it is causing neurotoxic, glutamate, excitatory neurotransmitters, nitric oxide, which might be in the case of your cyanide poisoning also and also might be a part of photochemical smog. Then we have botulinum toxin, Botox, how it is causing neurotoxin, tetrodotoxin coming from pufferfish or blue ring octopus, mercury metal, carbon disulfide, benzene, solvent carbon tetrachloride, and nitrobenzene. Okay, so one more question we will see. All of the following are true regarding ethanol and the liver except. So, alcohol dehydrogenase is the only inducible enzyme in chronic alcoholism. Wrong, because in case of alcohol metabolism, we have three different enzymes. One is CYP enzyme, CYP3A will be involved. Another in the catalase enzyme will be involved, and alcohol dehydrogenase will be involved. That is the reason only alcohol dehydrogenase is the not right option. So we will see what are the other options. Ethanol inhibits the transfer of triglycerides from the liver to the adipose tissue. This is very important. This you will be learning in the case of lipid lowering agents also this particular type of mechanism. For example, statins or like that. And inactive form of aldehyde dehydrogenase is formed in 50% of patients. As I told you, there is a ethnic variation in the metabolism of alcohol. That also you have to remember in mind. Third one is the catalase, fourth one. The catalase pathway is a minor route of ethanol metabolism. Again, you have to read with respect to alcohol metabolism, no? How the alcohol is metabolized in the case of primates, that is in the monkeys, and in the case of rodents, what are the enzymes which are involved? There is a difference based on the enzyme and based on the metabolite, toxic metabolite which is formed. So one question with respect to that also you'll get in exam. Now we'll see what are the adverse effects of alcohol on the heart. Okay, so what is cardiotoxic chemicals? We'll see. What are the cardiotoxic chemicals having primary concern? Many substances can cause cardiotoxic response directly or indirectly, whether direct consumption of this particular xenobiotic chemical or certain times not immediate, but the formation of a toxic metabolite, it will cause cardiotoxicity. However, only chemicals primarily act on the heart or whose cardiac toxicity is established include alcohol. So majorly alcohol is going to cause alcoholic cardiomyopathy. What is happening in the case of alcoholic cardiomyopathy is this is a normal heart. Here you can see normal ventricles are there. But in the case of alcohol toxicity, these ventricles no they become enlarged left and right ventricles due to dilated cardiomyopathy. This is, you can see, before alcohol consumption, this is a normal heart. Upon alcohol consumption, there will be increase in the size of the heart. Here you can see an open transectional transfer section of the heart. You can see how the ventricles are dilated. Increase in the size of the heart will also take place. Dilated ventricles, both right and left ventricle, you can see. Okay, so other examples apart from alcohol which are going to cause this adverse effects on the heart are, so read about, pause the video, I'm not discussing here, read about these cardiotoxic and chemicals, digitalis, which is act as an inotropic agent, quinidine, anti-malaria drug, but it's having anti-arrhythmic action also, procainamide, and non-cardio such as anthracyclines, adrimycin, which are having cardiotoxicity as an adverse effect. Okay, they have listed out some natural products also and some plant and animal toxins. So pause the video and read here. And here they have listed what are the metals, what are the drugs which are going to have adverse effects. So this question is with respect to what are the xenobiotics which are associated with sideroblastic anemia. So coming to anemia, no, we have different types of anemia are there. Aplastic anemia, sideroblastic anemia, megaloblastic anemia. So one question with respect to anemia also you will get in the exam. Here the question is with respect to sideroblastic anemia. So they have listed of the example. So ethanol is also going to cause sideroblastic anemia. Okay, read this thing, and here we will be seeing how the alcohol is going to cause cancer. So I have listed out from the class and CD summary only. These are tables are taken and from the PK Gupta. So there are different examples and what type of toxicity they are going to cause. What is the mode of action which is responsible for causing cancer? Particularly in the case of alcohol, it is going to cause liver cancer, it is going to cause mouth cancer. So here the mechanism is mainly through oxidative stress. Alcohol is going to generate reactive oxygen species because of which it will cause cell death, apoptosis or necrosis, and it will cause either liver cancer or intestinal cancer or oral cancer or breast cancer. Okay, now we'll see last slide. We'll be discussing about alcohol with respect to analytical toxicology. So alcohol, no, it is used as an abuse. It is used as a recreational for a recreational consumption. It is also used as a drug of abuse. So how in the case of analytical toxicology or forensic toxicology, how we can measure alcohol? Uh, with respect to that also, you'll get some questions in the exam. For example, blood alcohol concentration. What are the instruments? What are the assays through which you can measure the concentration of the alcohol in the blood, plasma, or serum? Uh, like that they will. And for example, there is a patient who comes to the emergency department who is having ethanol poisoning, alcohol poisoning. How we are going to treat that particular alcohol overconsumption of alcohol? How we are going to treat? So one question is which of the following technique is helpful in removing ethanol from the body? The right answer will be dialysis. Okay, activated charcoal as an adsorbent you cannot use for alcohol poisoning. Diuresis you can not use it. Extent of urination, that cannot be. Hemoperfusion also you cannot use this because this might be used in the case of iron poisoning, not here, where desferrexamine also will be used. So dialysis is the right method. So whenever a patient comes who is overconsumption of alcohol, you can perform dialysis. Next one is which of the following is most commonly used as drug of sexual assault? As I told you, know, alcohol, some people use it as a recreational purposes consumption. Some they use it as a drug of sexual assault or drug of abuse. They will try to give it to the opposite gender. So the most listed in the Clayson textbook note, they have given the list. What are the top 10 list of drugs which are used for sexual assault. So alcohol is listed in that. So read in that analytical toxicology chapter in the Clayson textbook. Next question is, which of the following drug is not properly matched with its most common analytical method? So ethanol cannot be done with immunoassay. So what are different assay techniques through which you can measure alcohol concentration, BAC levels, that you go and refer, check. And which of the following substances is not absorbed by activated charcoal? So activated charcoal, no, the main mechanism is adsorption. So alcohol cannot be removed by this adsorption technique. It has to be done with dialysis technique only, or alcohol has to be metabolized and removed through urine. Okay, so iron, ethanol, and methanol poisoning, all these type of three poisonings, you cannot use it. You cannot remove this poison by activated charcoal. Coming to iron, you are using desferoxamine. Coming to ethanol, dialysis. Okay. Coming to methanol, methanol poisoning, you can treat it by using ethanol. Okay. So here I have listed some of the clinically important alcohols and their antagonists, which can be used for in the case of emergency department by the physicians. So first thing I will say, repeatedly in your exam, you will get questions with respect to ethanol poisoning, methanol poisoning, isopropyl alcohol or rubbing alcohol it is called, and ethylene glycol. Some questions with respect to glycol also you will be getting ethylene glycol, DGME. So glycol poisoning is also listed in the solvents in the Clayson chapter, and it is a repeated topic for the FDA inspector also. So how can you treat this alcohol withdrawal? There are certain individuals who want to withdraw alcohol, then you can use it by using this one of the vitamin, that is thiamine, and sedative hypnotics like diazepam can be given to these patients. Next, drugs to treat alcohol dependence. There are certain individuals who are highly addicted to alcohol. They are completely dependent on the alcohol consumption. So how you can get rid of this one? By using disulfiram, naltrexone, which is used in the case of morphine poisoning also, acamprosate. So these are things which are administered by the doctors, by the physicians. Next is drugs to treat acute methanol or ethylene glycol intoxication. As I told you, no, methanol poisoning can be treated by ethanol. Another drug is which physicians recommend is omeprazole. They will give omeprazole for the treatment of either ethylene glycol poisoning or methanol poisoning. Hope lot of information was there in this video with respect to alcohol, because I tried to cover various target organs, like how alcohol is causing liver cirrhosis, how it is having adverse effect as a neurotoxin, because alcohol is used in lot of industries as a solvent. So workers will get exposed. So it is going to, most of the hydrocarbon solvents, if you see, they're going to cause neurotoxicity and cardiomyopathy, increase in the heart size, and cancer. Okay, so and also read about analytical toxicology. BAC related questions they'll ask. Blood alcohol concentration, what is the limits? That question also they'll ask in the exam. Thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Thank you so much. All the best for your exam.